How to immigrate to the United States as a physician. There are two main ways of becoming a physician in the US. The first is going through college and medical school in the United States. However, if you are already a physician in another country, or if you've chosen to attend medical school outside of the US, you can still become a US physician by completing a series of steps. You will need primarily to prove you are an international medical graduate or an international medical student, IMG or IMS, and second, demonstrate knowledge and competence in the field of medicine. In the United States, this type of accreditation is handled by the Education Commission for Foreign Medical Graduates, or ECFMG for short. First, you need to demonstrate that you are indeed a student or graduate from a medical school. In order to do this, you need to submit two forms in addition to your medical diploma. You need to submit Form 183, which proves you are enrolled or graduate from the medical school. Actually, you need to take Form 183 to your school so that they can send it to the ECFMG. Exceptions may apply if your school has a direct internet connection with ECFMG system. You also need to submit Form 186, which is notarized and proves that you are yourself. This can be done through a quick camera video. Once you've submitted Forms 183 and 186 and been accepted, you will have also to send your medical diploma, which has to be translated by a certified agent. Once all medical school documentation has been submitted, you have to demonstrate your knowledge and competence and show that your abilities are on par with those of American physicians. Roughly the whole process can be synthesized as documentation and tests, so this is the tests part. This series of 4 tests, colloquially known as the STEPS, form the United States Medical Licensing Examination, or USMLE for short. The USMLE is formed by 4 steps. However, only the first 3 are required for certification. The USMLE is not exclusive to foreign medical graduates. Actually, it serves a triple purpose. The USMLE is taken by all medical graduates in the United States and abroad in order to demonstrate their medical ability. This way, it serves as a universal accreditation exam. Additionally, the grades on the USMLE Steps 1 and 2 CK will be used usually for residency selection, a process known as the match, which means that the grades you get on these steps will likely influence your ability to secure a position in your desired residency. Third, it also allows foreign medical graduates and students to demonstrate their ability and enter the United States physician force. Beware though that from 2024 onwards, you will need to graduate from an accredited school in order to be eligible to take the USMLE. So if your school is not accredited, please consider taking the exam before that date. And if you haven't enrolled in medical school yet, consider one that has already completed accreditation. Concerning the tests themselves, Step 1 is composed of 7 blocks of 1 hour with 280 questions in total. You also get a 1-hour break to distribute between blocks as you see fit. Step 1 encompasses basic disciplines: pathology, physiology, pharmacology, biochemistry and nutrition, microbiology, immunology, anatomy and embryology, histology and cell biology, behavioral sciences, and genetics. Step 1 grades are particularly important because they are used as a cut-off for various residency programs, meaning that if you have scored below, for example, 240, you may be out of a series of programs already. Step 2 has 8 one-hour blocks, amounting to 318 questions and 9 hours in total with a 1-hour break. Step 2 CK regards clinical disciplines, including medicine, surgery, pediatrics, obstetric and gynecology, and psychiatry. And Step 2 clinical skills consists of seeing 12 patients, which are actually actors, and has no grade. It's graded as pass or fail. It should also be noted that Step 1 will eventually become a pass or fail exam as well. However, for the time being, it's still graded. Step 3 is also part of the United States medical licensing examination, however, it's not required for ECFMG certification. Quite the opposite, it itself requires ECFMG certification before you can attempt it. Step 3 is required for US physicians to practice medicine unsupervised. Finally, the US is somewhat unique among many countries in that it requires a physician to complete a medical residency in the United States in order to be eligible to freely practice medicine. Therefore, if you've already completed a medical residency in your native country, do consider you will most likely have to redo it in the United States. Medical residency in the US usually ranges from 3 to 5 years with a few exceptions. Please note that this is just a synthesis of the entire process and should not be taken as a guide. For more accurate and up-to-date information, please consult the ECFMG website, where you can also download the appropriate booklet for the current year. This video is meant only to provide an outlook and should not be taken as a basis to make career decisions. Thank you very much for your attention and good luck on your journey.